not all people develop sexual issues and issues around same-sex orientations the same way, but there are often known pathways of development that contribute to these for many people. So not in all cases and in all circumstances, but for some cases and in some circumstances, obsessive compulsive disorder can be intricately linked to sexual compulsive behavior, and also sexual abuse can contribute to what some people call repetition compulsion of the abuse experience. Let's say, Timur, you've talked probably on your show about scrupulosity. Scrupulosity is known in the Catholic tradition as a distortion of an understanding of the laws of the church that can contribute to a repression of a normal, healthy emotional life in the spiritual realm. If this obsessive compulsiveness is directed towards sexuality, it can create an undue burden of stress around sexuality that actually has a sort of backward impact, which leads towards compulsive sexual behaviors. Resolving the obsessive compulsiveness, if those compulsive behaviors are with people of the same sex, can reduce the compulsive behaviors and reduce the interest in same-sex sexual activity. So sexuality is a complex thing with a lot of factors that contribute to it. And in therapy, when you use standard psychological interventions to address some of these traumas and compulsivities, you can see and help people live a more peaceful and more free life that is in line with their conscience and really looks to healing the person and not trying to change their feelings in any way.
So if someone's listening, they're struggling with same-sex attraction, they're confused about their gender, maybe there's been some sexual abuse, where can people go and how would they start in using this form of therapy to address underlying mental concerns and traumas and not just the same-sex attraction per se?
The first thing for your listeners to remember is that even if nothing ever changes with their struggle, with whatever that may be, whatever kind of same-sex sexuality or other sexual dysfunction or wounding around their sexuality, that God loves them just as they are. That's key, is finding a therapist that helps remember that. But look to reintegrativetherapy.com for more information about our clinic and our work.
For more of this conversation, head over to relevantradio.com/trending to listen live or subscribe to the daily podcast.